Welcome to the Integrated Procedure Team. We are procedure nurse specialists who specialise in the insertion of central venous access devices. Together with our procedure team assistants, we aim to deliver outstanding care. This video has been produced to supplement the leaflet, giving you information about the port. We will explain the benefits, risks and alternatives to this procedure. We want you to be informed about your choices to help you to be fully involved in making any decisions. Please ask the procedure nurse specialist anything you do not fully understand or wish to have explained in more detail. What is a port? A port is a type of central venous access device, usually made of silicone rubber or polyurethane. One end of the tube sits in a vein, the other end is attached to an injectable port chamber that sits underneath the skin, usually on the upper part of the chest. These are usually recommended for patients who need certain types of intravenous therapies that irritate or damage the smaller veins, or who need IV access over a longer period of time. Benefits of having a port. The main benefit is that the port is a secure method for administering anti-cancer therapy. The port can also be used for blood tests. Where the procedure takes place. The procedure is performed on a bed within the IPU by a procedure nurse specialist. The catheter can be placed in different veins, the most common being a vein at the base of the neck. The particular vein that we use and the side of the body will depend on the reasons that you need the port and how large the veins are upon examination with an ultrasound machine. What happens during the procedure? The best position and site for the port insertion will be discussed with you before the procedure. However, sometimes it is impossible to decide until during the procedure. We will remove any hair from the insertion site to prevent infection. If sedation is required, a cannula will be inserted. More information will be provided on an individual basis. We will clean your skin and numb it with an injection of local anaesthetic. This may sting for a short time and on rare occasions could make you feel drowsy. The procedure will be carried out under full sterile conditions. We will then create a pocket under the skin where we will place the port. This will usually leave you with a scar about 3 to 5 centimetres in length. The catheter is passed under the skin and inserted into the vein. ECG technology is usually used to confirm the line tip is left at optimal position. If this is not possible, an X-ray then may be needed. The catheter is then attached to the port. Internal and absorbable stitches are placed with steri-strips to aid wound healing. You will usually have 2 dressings, one to cover the port under the collarbone and one at the base of the neck, which is the entry point to the vein. The procedure takes approximately 30 to 45 minutes to complete. What to expect after the procedure. You will be transferred to the recovery area for a short time after the procedure. If you are an inpatient, you will be transferred back to the ward. You can eat and drink as soon as you have recovered, and you may get up as soon as you feel able to, and once your specialist nurse has assessed you. You will be usually with us for up to 2 hours. We will then arrange for the port wound and the stitch at the base of your neck to be removed after 7 days. Most people who have had this procedure can resume normal activities, but you may have some discomfort in your neck or chest, so you might need to wait a little longer before resuming increased activity or exercise. It may feel slightly bruised and sore for a few days when the local anaesthetic wears off. Take regular pain relief if required until this settles. When not in use, the port needs to be flushed every 4 weeks to prevent it from blocking. This will be done when you visit the hospital. Please ensure that people caring for the port, taking blood samples, doing the monthly flush or giving treatment thoroughly wash their hands before handling your port and are competent in the care of it. If you have any concerns, please do not hesitate to contact us. Risks of the procedure. Insertion of a port using ultrasound is a very low-risk procedure. Many people have lines inserted by the team at the Christie every day without any problems. But in order for you to fully consent to the procedure, we do have to tell you about the small risks involved. Infection. When receiving intravenous anti-cancer therapy, the body's defences are lowered, making you more at risk of infection. Signs of port infection include redness, pain, swelling around the port or a raised temperature above 37.5 degrees. Please monitor your port and temperature daily. If you notice any signs of early infection or experience shivers or shakes, particularly after the port has been used, please contact the chemotherapy hotline immediately. This line is staffed 24 hours a day by nurse practitioners. Port erosion. There is a small chance that the port may wear thin the tissue above the port or even break the skin. If a patient loses a lot of weight, the tissues can thin over the port and the patient may be at risk of this. If erosion occurs, the port will be removed. Thrombosis. When a catheter sits in a vein, there is an increased chance of a blood clot forming in the vein. Signs of this include pain, swelling and discomfort in your neck or arm on the side that the port has been placed. Arterial puncture. Puncture of the artery that may cause bleeding. Approximately 1 in 1,000 patients may have an arterial puncture. The specialist nurse is careful to prevent bleeding and will take a blood sample to check that your blood is able to clot normally. Lung puncture. This happens in less than 1 in 13,000 patients and may need further treatment to avoid breathing complications. You will usually have to stay in hospital until the lung has healed. Stenosis. If you need the catheter for a long period of time, there is a risk that the vein becomes narrowed or stenosed. If this happens, then we may need to put the catheter into a different vein. Extravasation refers to damage caused by leakage of solution from the vein to the surrounding tissue spaces during intravenous administration. Extravasation of some chemotherapy drugs from ports can cause tissue damage and may need surgical removal of the port and the affected tissue. There are further rare complications that may occur. Your specialist nurse will discuss these with you as appropriate. Important things to remember. Do keep your port covered with a waterproof dressing for the first week. Ensure that anyone accessing your port has washed their hands thoroughly and is properly trained. Continue to wear your seatbelt whilst in a car. Remember, once your treatment is complete, your port may be left in place, or you can return to us and we will remove it. If your port is to remain in place, please ensure that it is flushed on a 4-weekly basis. On the day of the procedure, we recommend that you have a light meal beforehand. We will discuss the procedure and any concerns that you may have and will ask you to sign your consent form. You will receive an information booklet and a district nurse form will be completed if required. This will be discussed on an individual basis. What happens when your treatment has finished? The port can remain in place indefinitely. We will, however, remove it if required. Your doctor will refer you back to us for this procedure. We hope this video has answered some of your questions about living with an implanted port. Please keep your information booklets containing the procedure team telephone number for reference and in case you need to contact us.